Hey, welcome to our Freedom from Suffering Now blog. I'm Dr. Steve Grinstead, and today I want to ask you a question to start this off. Why does it take a team to provide effective chronic pain management when someone has chronic pain and coexisting disorders, including addiction? I know that may sound like a dumb question, but it's a question that often does not get asked, and people only receive one piece of treatment, like symptom management, medications only, for example, or other people might just get social support only through self-help programs like 12-step programs, smart recovery, rational recovery, etc. Or other people might just get psychological work, counseling, therapy, etc. And for me, it has been a real journey working with people with chronic pain and coexisting disorders since 1984. And I believe that it takes a team, and more importantly, the patient needs to be the captain of the team, because there's too many things going on and you have to work with the whole person. And when I say working with the whole person, I mean we need to take a look at the biological component. What is the person's biological functioning? How much brain damage has been done with living with debilitating chronic pain for a long time, combined with the effects of medication? And some people even mix alcohol with their pain meds. So we also need to see, what are they doing nutritionally? What is their diet and nutrition plan like? What is their physical level of activity like? What is their functional ability? So functional restoration is a really crucial part of chronic pain management. And so we need to have a special teams coach there, like a functional restoration physical therapist, for example. The next part is dealing with the psychological. Absolutely. And this part is really crucial to help the patients determine how much of their pain is physiological and how much of it is psychological, emotional, and we have both. It's not all in our heads, for example, although it really is, because that's where the pain signals get interpreted. But when a pain signal goes from the point of injury up to the brain has a thinking response and a feeling response, the frontal lobes to the limbic system. And often with chronic pain, this becomes like an amplifier circuit. This also becomes what I call suffering. I believe freedom from suffering is possible. I believe it's every patient's right. And I also believe that they need to be responsible and get into action in order to achieve that. Now, the third section is the social. How does the person integrating with friends, family, community? Many times living with chronic pain tends to isolate a lot of people. And if they develop a mental health disorder or an addictive disorder, that gets even worse. So we need to assess, where are they at there and what do they need to have in place to have some teammates? I believe people need professional teammates and personal teammates. People they have to pay, for example, and people they don't have to pay. This is where some of the self-help groups, Chronic Pain Anonymous is a really great program. They have a great website, chronicpainanonymous.org. It's a very wonderful site and a lot of resources there for people living with chronic pain. And we're not done yet, though, because there's one more component, and that's the spiritual. And that's the piece that gets most often overlooked. So it's biopsychosocial, spiritual. In the spiritual, when I work with people, I always do assessments in those 4 areas. And when I get to the spiritual assessment, I want to find out, on a 1 to 25 scale, how much in harmony they are with their spiritual values, practices, and principles. And unfortunately, what I find when I first start working with many people, they score anywhere from a 5 to a 15, and it's not helpful. So I need to help them find some spiritual mentors, spiritual practices, principles, and values that they can glom onto. So I've developed an instrument called Claiming Your Spiritual Power, and I help them do that. So I show them, here's some of the typical ones, which ones can you start implementing and be in total harmony with. So we've got this whole person approach going on. Now, it's really important that if you have different teammates, they be communicating effectively with each other and clearly with each other. And we all need to remember that the patient is the captain of the team because it's their pain, it's their recovery, it's their mental health, it's their addiction, and they need to be proactive. They need to be active participants, not passive recipients of the treatment process. So teamwork is a must. You know, if you're watching this on YouTube, go to the link below and look at the remainder of my Freedom from Suffering Now blog to get some more information. You'll also see a link to get even more insights on walking the tightrope of pain management and addiction. I really want to encourage you to check this out. It's low cost, and in addition, I give you a free gift right now. For a limited time, I will be giving you a series of addiction-free pain management worksheet exercises, absolutely free. And after you watch this 3-part webcast, I promise you, you will be much more effective utilizing those worksheets. So don't hesitate, you know. Go read the rest of the blog, opt in for the webcast. You won't regret it, I promise. If after watching the webcast and looking through the worksheets, you feel like, you know, this doesn't work for me, let us know and we'll give you your money back, I promise. So, you know, I want to help people. I've been helping people for a long time. And my primary mission since 1991, when I started working with Mr. Terry Gorski, was to develop a mission plan. And my mission plan is to teach people how to help people. So thank you very much today because you're helping me accomplish my mission. And don't delay, take action right now. Like we always want our clients and patients to get into immediate action. Well, I want that for you too. So don't hesitate, and please check back frequently because there are definitely more to come. A lot of exciting things coming up this coming year. Thank you for joining me today. I really appreciate it.